Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers. The Foundation's mission is to enable seniors to live with independence and dignity in their communities. We often hear the overworked phrase, "it takes a village" when raising a family. But this phrase also rings true when exploring elder care, which often includes both formal and informal caregivers. Today we're going to discuss caregiver resources. I am pleased to have Judy Millner, a nurse and geriatric care manager, who's the director of Secure at Home, which is part of the Jewish Family, Children Services of Greater Mercer County, and Karen White, who's the director of Working Families Program at the Center for Women and Work at Rutgers. Thank you for being here today.
Thank you for having us.
You know, it's a really big topic. And we often get calls in the office from people that are doing a variety of things for their family members, but they don't necessarily identify themselves as caregivers. So Judy, you probably get similar calls. How would you describe a caregiver?
Well, that's absolutely correct, because many people define their what they're doing for someone that they're taking care of as a relationship. They're a spouse, they're a parent, they're an adult child, but in actuality, they're a caregiver. There are about 65 million caregivers in the United States at the current time, and they're people who are doing things such as grocery shopping, paying bills for someone they care about, organizing their doctor's appointments. All of this is caregiving. So really anyone who is responsible for the safety, well-being, and assisting a person, being an older adult or a child with needs, in that way is really a caregiver.
Yeah, it's amazing in some aspects that, you know, it's the relationship that they have, and they don't necessarily see what they're doing is just so incredibly crucial to that person staying in their home.
Oh, absolutely. And the average caregiver has a lot of other responsibilities as well, in addition to helping the person stay in their home in a safe way. The typical profile of a caregiver today in our country is that there are more women, although the number of men are increasing. They're middle-aged, usually between 35 and 55 or 60. We push the middle age up as we get a little bit older. They work outside of the home, which makes the activity of caregiving sometimes even more stressful or difficult. And they can caregive up to 20 hours a week, some people even more than 40 hours a week.
I'm glad that Karen's here, because as we go through the program, we'll be talking more about people that are really stretched between their work environment and their caregiving. But we really want to connect caregivers and seniors to services. So if someone was looking for caregiving services, if they've come to that conclusion, what should they look for?
Well, the first thing that they should do is not be afraid to ask for help. We like to talk about two forms of caregiver resources. One is informal, and that would be your family, your friends, your coworkers, and perhaps your clergy. And then we talk about the formal resources. That would include such organizations as the area agencies on aging, the state, community organizations such as social service organizations like our agency, Jewish Family and Children's Services. In our area, we are in Mercer County, there's the Greater Trenton Behavioral Health Care. The senior centers can be wonderful. All of these resources actually provide information and referral. So they're the more formal way, and as you mentioned, the Aging and Disability Resource Connection.
You know, it's interesting because while you want to get services for the senior or for the elder that needs care in their home, the caregiver themselves often need support. And so, you know, whether it's a caregiver support group or just the idea that they can get respite. So, I mean, I think that these are important resources too when when someone actually has identified themselves as a caregiver, that there are so many things out there that they can look for.
Absolutely. Respite is actually a service and a resource that I think some caregivers are really not familiar with.
Let's explain what respite really means.
Okay. Respite is actually a structure in the state of New Jersey that is statewide and countywide. The care recipient is the individual that actually has to qualify for the respite services.
So the adult or the elder.
Exactly. But the client is actually the individual that's caregiving for the care recipient. And you need to contact the respite resource in the state. And I'll talk a little bit about reaching out for resources and a couple of tips for that. And it can actually allow for some home health aid support between 1 to 5 hours a week, some medical day, 1 day a week, or a social day program, which can be up to 2 days a week. So this allows the caregiver to have their loved one supervised, assisted, and well cared for, so that they could either be working, if necessary, or actually taking some time for themselves.
So when you talk about medical or social daycare, this is adult daycare.
Adult daycare, absolutely.
And there are, as you said, 2 different types, I think, which is very important for someone to understand.
Right, and the benefit in the state of New Jersey can be up to $4,500 a year, which is pretty significant.
Is that for the total respite package or for
Yes.
a particular service?
That's the total respite package, but it can be combined. So there can be some home health aid support and a half a day, say, at a medical day. The other thing that's an interesting option is that there's a family guided option in the state of New Jersey, where the family can actually have a caregiver designated or an agency that the state does not work with per se, and that benefit can be up to $3,500 a year. The caregivers need to pay for the services up front, and then they can submit their receipts to their more local county agency for reimbursement of those services. So it's a wonderful benefit.
Right. I'm not so sure that I knew about that second one you just mentioned. Now, are we presuming that someone has to be income eligible to receive these services?
Yes, and if you contact the respite office for the state, they will work you through the application process.
Yeah.
It varies from county to county based on the population of older adults in that county in terms of availability.
And I know that we've talked about the county offices on aging and the ADRCs, and so we'll put that central phone number also across the bottom of the screen so people can see that, because I think, between the respite office number and the central hotline number, that they certainly can get connected to those services.
Absolutely.
So, and I would venture to say that probably there are a variety of providers for caregiver support groups.
Yes, and caregiver support groups are very important. They are safe environments for caregivers to talk about their concerns, their stress, sometimes some of the emotions that they might not be willing to share with others. It's a great venue for them to share with other people who are going through the same thing. The social service agencies can offer many caregiver support groups, but there's also, and that can be also resourced through the ADRC, a clearinghouse in the state of New Jersey for caregiver support groups. They're usually peer-to-peer support groups facilitated by a professional or someone who's trained. As with other caregiver resources, I suggest that people look for groups that are local and convenient for them.
Of course, because they're doing so many other things.
Right,
It needs to be
exactly.
convenient. So I think, I think those are great suggestions. And I would just wonder, perhaps there's ways that a caregiver can make life a little bit easier, not only for their caregiver recipient, but for themselves. So do you have some tips you like to offer?
Well, my tips really are more focused around getting help.
Okay.
So there are
That's
some easier ways for caregivers to look for these resources. So I have a few tips, and they're actually adapted from the ADRC manual. One of them is to talk to a real person. to make sure that you are taking notes, and if the resource you're looking for is not immediately accessible, ask the person that you're talking to if they can connect you, because sometimes if they're not able to provide exactly what you're looking for, they're going to be able to connect you to a professional who can. Be persistent. Try to stay local, as I said, because a resource 2 counties away, it's not going to be that helpful for you. Ask for a resource and referral, and importantly, and I say this to the caregivers we work with all the time, is try as much as possible to look for resources in advance of a crisis. Because if you can do some planning, your options are definitely more expansive than if you're working in a crisis, where if you need something right away, sometimes your choices are more limited.
Certainly, and I think that's a very wise thing to share. I also think that there are a lot of resources online.
Absolutely.
And even some books and things like that.
Yeah, there are, I mean, this is an issue with, as I say, the statistics, 65 million, that's growing. There are a lot of good books and there are a lot of resources online. What I suggest, however, is that people make sure they're on an informational site versus a marketing site.
Sure.
So make sure that it's not just an agency that's trying to sell a caregiver a service. Make sure it's informational.
That's great. That's great. I do have one book here, which I thought was kind of interesting, which was written at one point by about one of our advisory board members, and it's called "Respecting Your Limits When You're Caring for Aging Parents." And basically, and she has another book that, which basically is "Your Good is Good Enough,"
Right.
And so I think she tries to offer some comfort to some caregivers that when they've done all the things you've suggested, that oftentimes there's still some emotional issues that really need to be dealt with. So
Absolutely.
there are some other books that we'll probably mention later. But one of the reasons why I wanted Karen to join us was I got a call in our office from somebody who was trying to identify how to support their parent when she was coming home from hip operation. And she worked for a small company that was a production company. And so she asked me about caregiver supports. She asked me if she could get paid as a family caregiver, but her parent was not necessarily going to be income eligible, and I knew that from the description. But as we were talking, I said, well, what about the paid family leave insurance benefit? What? What? This is just such an unknown benefit, so I'm really glad that Karen is here to talk about that. So Karen, can you give us some history about this?
Yeah, I'm delighted to. I'm delighted to be here, especially as we're celebrating the 20th anniversary of FMLA, which Federal Family and Medical Leave Act passed in 1993.
20 years.
Yeah, the first piece of legislation that actually looked at trying to help families balance the demands of family caregiving and work responsibilities. It provides 12 weeks of job-protected, unpaid leave for workers who work for companies with 50 or more employees. So it is a groundbreaking in that it is the first piece of legislation. Doesn't cover everybody, and it's unpaid.
Unpaid. So this is, as you said, a groundbreaking rule that's been around for 20 years that recognized the role of a caregiver and gave them some job protection.
Absolutely.
But no benefits.
No pay.
The benefit
attached.
is job protection.
Correct, correct. New Jersey policymakers and advocates, other stakeholders, looked at it and knew that they had to do more for their working families. They, in fact, had preceded the federal FMLA with it. The state had enacted its own Family Leave Act, similar to the FMLA, which provided job-protected unpaid leave. But they knew they had to do more. In 2002, California expanded its temporary disability insurance program to provide a family leave component. Now, New Jersey is one of the 5 states that has a temporary disability insurance program. Policymakers here looked at the California model and said, we can do that. Let's try to do that. The program provides workers with partial wage replacement up to $584 a week, 2/3 of their weekly wages, up to $584 a week.
Let me stop you.
Yes.
Let me ask a couple of questions.
Sure. Sorry.
Okay, so I think it's really interesting. And how is the benefit paid for?
It is employee paid. It is an employee funded program.
So it's a withholding.
It is a withholding. But the most any worker pays this year is $30.90.
Interesting.
And in return, what they get when they need to take time to care for a loved one or to bond with a new child, they get up, 2/3 of their weekly wages, up to a maximum of $584 for 6 weeks of leave.
For 6 weeks of leave. And if they only need 4 weeks, then they get it for the 4 weeks, I presume.
Correct.
So, so I think that's really very important. Does someone have to be income eligible?
Yes, but the
Really?
eligibility, the bar is very, very low. You have to have made $145 a week during the 20 weeks of the base year, or a total of $7,000 during the base year. So it's a very low bar that they have set for eligibility.
That's, I think, very interesting. When we're kind of tossing a word around eligibility in totally different ways here, because obviously to get caregiver resources, in some instances you have to be income eligible in terms of having a income that makes you Medicaid or eligible for reimbursement of services. And in this way, you have to have a certain amount of work history.
Well, it's an insurance program. You're paying into the insurance program. That work history has allowed you enough payment into the program to allow you to get the benefit for it.
Well, I think that's really very helpful. How does one access? I did go online, and so I have to admit that. I looked at the form, but can you explain to people how they access the benefit?
So it is self-initiated. You go to the Department of Labor and Workforce Development's website. You can access the application. You have to complete it. You have to have your employer and the physician who is caring for the family member complete the application, and you submit it to Department of Labor. Usually takes them about 14 days to process it for payment.
And I guess I would wonder, if so many claims have been filed, what's the approval rate? Do you know?
It has a high approval rate. I don't have the number off the top of my head. Most claims are approved. There are some that are not approved. Some of the reasons for not being approved are people applying for caregiving for a non-qualifying family member. So a family member who, so in order to qualify, the family member must be a child, a spouse, a parent, a civil union or domestic partner. An aunt, an uncle, a brother, a sister are not qualifying family members.
A mother-in-law.
Mother-in-law is not a qualified. That's an interesting question, because a mother-in-law is not qualifying.
A father-in-law, not qualifying.
Not qualifying.
Okay.
Not qualifying under the New Jersey Family Leave Insurance Program, but qualifying under New Jersey's Family Leave Act. So you could take unpaid job-protected leave, but you would not be able to access the wage replacement.
Well, it's interesting to have both of those things, and I think when we were talking about this opportunity to discuss this together, the family paid leave insurance does not give you job security, right?
It does not. It applies to most all workers in New Jersey. There are a few exemptions. Federal employees are not a part of the system. It applies to all workers, including those workers that work in small businesses. Those workers who are exempt from or not included in the protections in the FMLA, which is the job protection. So if you have an event where you need to take time to care for a loved one and you work for a small business, they can let you go. You have no job protection. What we found in research, though, is that for most small businesses, they know their employees.
Right.
They care about their employees. Their employees are family to them. They just never had the deep pockets to be able to pay them for taking, while they took the time to care. But in fact, we're already following FMLA and giving them the time that they needed to care for their family members.
And it's a very nice phrase, time to care. It just really is. It's very appropriate. And some people's needs are longer. I think, Judy, when you think of a caregiver, you think of somebody who has an extended time doing the job?
Oh, absolutely. I believe statistically the average is 2 to 4 years. So it is usually a period of time. But that's why it's important, in addition to what you're discussing, is to have the access to the other resources from state, local, all the public and the private resources.
And as I said, the call that we received in our office was really about somebody who wanted to step in during that rehab period when someone was home recuperating from a hip operation. And so I think what's nice is the blend.
Right.
Because, and obviously you've mentioned too that this is often used for people that are bringing home a new baby, whether it's an adopted child or whether it's their own biological child. So
Correct.
there's a lot of benefits here. And it does seem like it's a very sensitive support that's out there. Is it underutilized?
Yes, it is. While it is a great and successful program and it is reaching hundreds of thousands of people, there is still more that can be done. The awareness of the program in New Jersey is really low. We just conducted a survey of residents in New Jersey and found that 60% of New Jersey's residents do not know about the program. That's pretty significant. There can be more done to make sure people know that it exists and how to access the benefits. The definition of family is very narrow, and it doesn't really encompass the reality of today's families. And the benefit rate could be higher. There's a lot of different ways that the program can be expanded. It's a good first start. It is great that it's working. With a few tweaks, it can be even better, made available to more. And I'll just say that when the program was being legislated, there was a big outcry from businesses about how it would ruin businesses. And the truth of the matter is, it hasn't. The sky has not fallen as they predicted. Right. And and most research shows that it is benefit to businesses, increases their workers' productivity and their motivation. So it's a win-win for everybody.
Sure. And it would seem to me that whether it's a small business or a larger business, that sometimes when someone's at work, their first contact is their human resource person. And it sounds like they need to have some more information about the program, I would imagine.
Yes, absolutely.
Yeah.
Absolutely.
And I think it's interesting, it is a benefit. It is not necessarily an overdone benefit. It's just modest, but it could mean that it enables somebody to actually stay home and do this important care that needs to be done.
For some families, it's the difference between being able to care for their family member and pay the mortgage,
Right.
and or to fall into severe financial
There's some information that indicates that when someone is a caregiver, that they have so many out-of-pocket expenses. Do you see that, Judy?
Absolutely, and the other benefit is actually to the employer, based on our experience, is that if the caregiver is able to have this benefit, they're not at work distracted, having to run out, you know, all of those.
Absolutely.
All of those issues that can occur. So it really benefits both the employer and the caregiver.
Mm-hmm. Exactly.
Mm-hmm. So I'm hoping that with Judy's help and hopefully the New Jersey Foundation for Aging, that we can publicize the paid family leave insurance benefit, because I think it's crucial. And I think, do you have tips for people when they want to really access this?
So we have I work also with the New Jersey Time to Care Coalition. Mm-hmm. And on their website, they have brochures and information, fact sheets about the program. Okay. There's an 800 number that you can call to find out about the program. Mm-hmm. So yes, we have lots of materials we'd love to share with you.
That would be wonderful. As I said, I did go on the temporary disability insurance website, and I looked at the form and went, oh my goodness. So I think the idea that there's tips out there that someone can contact the coalition, because it looks a little overwhelming, but you just have to do the paperwork.
Mm-hmm. Our information is a little more user-friendly than the Department of Labor's.
Well, you know, it's nice to have both.
Yes.
And so I think it's very helpful. So I think as we reach out to caregivers in our daily work, it's a nice tool to offer them as well. So I think that I appreciate the fact that you're both here, and if there's just the idea that you've met and can share information, I think is very helpful.
Yeah, it's great. Thank
Absolutely.
you.
I'd like to thank our guests for being with us today and sharing their time with us. Aging Insights is produced by the New Jersey Foundation for Aging. To make donations to the foundation or to sponsor Aging Insights programs, go to our website at www.njfoundationforaging.org, or you can simply call our office at 609-421-0206. We want to remind you to find out about senior services in your area. Please contact your County Office on Aging, also known as the Aging and Disability Resource Connection in your county. You will see a listing of their numbers on our website, or you may call the state hotline number to reach them. The number is 1-877-222-3737. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.